Thank you for the opportunity to present our work. These are our disclosures. Depressive and anxiety symptoms are prevalent, frequently comorbid, and disproportionately affect women. Depressive symptoms have been found to be highly prevalent in women with urinary incontinence, but we know very little about the relationship between depressive and anxiety symptoms and postoperative pelvic floor symptoms. Our aim was to determine the prevalence of anxiety and depressive symptoms in women undergoing surgery for pelvic organ prolapse 3 and 6 months postoperatively, and to describe subjects with persistent symptoms. This was a prospective cohort study of women with symptomatic prolapse undergoing surgery. Our primary outcomes were depressive symptoms as defined as a PHQ-9 score of 10 or greater, and anxiety symptoms as a Beck Anxiety Inventory score of 16 or more. Of the 275 women enrolled, 167 had depression and anxiety data for all 3 time points and are included in this analysis. Subjects had a mean age of 62 years and a median leading edge of 3 centimeters. This figure shows depressive symptoms in the top red dark line, anxiety in pink, and comorbid anxiety and depression in the gray line. Depressive symptoms were significantly lower at the 3 and 6 months postoperatively, and the prevalence of anxiety and comorbid depression and anxiety showed a downward trend. 12 subjects had significant depressive symptoms postoperatively. Significantly different baseline variables between subjects with and without postoperative depressive symptoms are highlighted in pink. Subjects with depressive symptoms were younger, had more comorbidities, were more likely to have had prior anxiety and depressive episodes, as well as having significantly higher PFDI and PFIQ scores preoperatively. At 6 months, women with postoperative depressive symptoms had significantly higher UIQ scores as well as PFDI scores. This presentation represents our preliminary analyses, but we are currently analyzing the data to assess for other factors that may impact depressive and anxiety symptoms and postoperative outcomes. The prevalence of depressive and anxiety symptoms decreases following surgery for prolapse, with depressive symptoms decreasing by 55%. In studies looking at the natural history of depression, remission rates are estimated as 23 to 43%, suggesting that the changes we've seen are not likely due to natural history alone. Many questions still remain regarding the relationship between mood and pelvic floor symptoms and the respective relationships with surgery. Thank you very much.
To pose a question, and please come to the microphones. Now, at 6 months, 12 patients were depressed, 6 remained depressed, and 6 were de novo depressed. But I just wonder, how successful was the operation? Why did the 6 patients get de novo depressed? Was it because the operation didn't work? And why did 6 remain depressed? Was it because the operation didn't work?
Yeah, that's a good question. Because the numbers are so small, it's difficult to find the exact relationship or give causality to the surgery, and those are the analyses that we're going to look more at individual level of the subjects who have incident depression or persistent depression to better understand.
But you didn't look into the results of the operation?
Oh, yeah, well, the results of the operation we have the measured outcomes of their symptoms. So we have those as their symptom scores. And we also have postoperative PUPQ results, but nothing stands out as a failed surgery.
Maybe I could just ask a question as well, Chiara. Did you notice any difference in those patients who were maybe counselled more, or perhaps were counselled by the nurse specialist rather than the gynecologist in terms of depression after the operation?
So all of the patients had similar counseling. All the practitioners counsel similarly, and we don't have additional counseling by other providers. So there wasn't a specific difference that we could outline.
Do you have the reasons why they dropped out? Because there was a lot of percentage that did not have all follow-up moments? Did they perhaps had more depression and anxiety symptoms?
Yeah, that's a really good question. When we looked at the patients that had incomplete data points, they were not significantly different than those who did. But some had, for example, 3 months but not 6 months, or 6 months but not 3 months, and so we didn't include them in the analysis.